Today, I already mentioned it, but we have Jessica Bento and Josh Henkin. Jess is a physical therapist. She's the Director of Operations for Innovative Fitness Solutions and Ultimate Sandbag Training, and she heads up the educational programs for Dynamic Variable Resistance Training. Josh Henkin is a strength coach. He's the CEO of Ultimate Sandbag Training. He's the creator of the Ultimate Sandbag and the Dynamic Variable Resistance Training System. They're both constant contributors to the Perform Better newsletter, and we're happy to have both of them back here today doing another part of their DVRT series. I had to throw that out, sorry. I will let them take over from here. Josh and Jess.
Thanks, Erin.
Thank you so much, Erin. We appreciate having this opportunity to be back. And this is a pretty comprehensive topic. We wanted to start with something small with like chronic pain. So there's so much that we want to cover. We just want to really get into it and start working with you guys. Now, I know a lot of people jump off these programs because you got to go see clients and patients. So there is going to be a masterclass that we're going to talk about at the end if you want to delve deeper into these topics that we will explain at the end. But this is going to be something that we do with Perform Better, and we'll discuss it more towards the end in case you do jump off. There is a great 6-week masterclass that delves deep into a lot of these topics. Now, Erin obviously already introduced us, so we won't spend a lot of time there. But Jessica and I always like to share that we are coming, to you guys with this approach from both her clinical perspective and obviously my expertise and more in the fitness and sports performance. So it's nice that you're getting the blend of the two. And again, a lot of this stuff is going to require us to have some context and perspective upon a lot of these topics.
All right. So sometimes in our efforts to make concepts more accessible to larger audiences, such as a webinar with a few hundred people or on social media, we tend to oversimplify things. Something like this graphic, I see this all the time in the fitness industry, just lift heavy things up and put them back down, or just keep it really simple. And that really misrepresents the complexity of our clients' needs and our issues. And it brings down the value of us professionally and what we can bring to the table. And something like pain isn't so simple. Really, we have more people living with chronic pain than cancer, heart disease, and diabetes combined. That's actually really huge when you think about it. More than 30% of people in America are living with chronic pain. Now, this can also lead to other issues. As you can imagine, when you're dealing with chronic pain, you can have issues with sleeping. That can cause mental issues, cognition issues. It can affect the overall quality of life. We start to see depression creep in. Things like suicide can increase with chronic pain. Now, this is really about fat loss as well, because individuals with chronic pain had 33% less weight loss than those without. And you can see a lot of those things. It's hard to break that cycle. That's one of the reasons why fat loss can be really challenging with individuals with chronic pain.
I think it may be obvious to people, but not at the same time, where one of the biggest reasons why people with chronic pain have a hard time losing weight is because the behavioral changes become more difficult because of the interaction of all these variables.
And then avoidance comes in. And I see this a lot with my patients. If you're having a lot of pain, you think about, like, can I make it to that restaurant? Do I have to walk far? Do I have to sit for long durations? They stop doing certain hobbies they enjoy, and the cycle just keeps going and going. And then they start avoiding pretty much everything for fear of increasing their pain.
And a lot of these avoidance behaviors can also be seen in just general stress-related type of actions too, where people who get very anxious or overwhelmed start to do things like overwork. They excessively exercise. We know that the people can overeat, drink too much, and they are the type of people that have to constantly be busy doing something. And while we think those things sometimes are more productive behaviors, they're actually things that feed into people having more pain, anxiety, and depression at the same time.
And then why not just work out? I hear this all the time. Well, if you just work out, you know what, your pain's going to subside, you're going to feel better. And we just talked about many of the challenges that individuals with chronic pain experience and why there's those obstacles to just work out, from just feeling tired for fear of having their pain levels increase, from the anxiety of possibly getting themselves to the gym, from depression to certain mood behaviors. There are lots of reasons why just working out doesn't work for individuals in chronic pain, and they really don't see an escape from their pain. I work with a lot of chronic pain individuals, and they just don't see an out, or they don't see the light at the end of the tunnel where they can actually find relief from their symptoms.
If you notice, the last 3 diagrams have all been circles because all these things interact with one another, making the cycle of pain one of the most challenging things for people to actually break.
Now, currently, there's no cure for chronic pain other than to identify and treat its cause. Oftentimes, it's difficult to pinpoint the exact cause when we're dealing with chronic pain. But today, we want to give you better evidence-based strategies with dealing with clients in chronic pain. And we're just skimming the surface of a really deep topic. Hopefully, you find even more interest to dive into a lot of these things that we're going to talk about today even further.
Now, of course, you guys are dealing with people with chronic pain, whether it's in the clinic or in the fitness thing or sports performance. And so you want to find out what should you do. And so what does everyone do nowadays? You go online, right? You go on social media, you try to find answers. And it probably isn't shocking to people to hear that when the research actually looks at the type of evidence that's being used on social media, when it comes to back pain, neck pain, shoulder pain, knee pain in general, usually it's not high quality evidence. So that sort of refers to a more frustrating situation where people are trying to learn solutions from people that aren't using the most current research or research much at all in providing, results and solutions for people. And of course, I think when we share this with people, a lot of you are going like, yeah, I know there's not a lot of good stuff on social media. And it can be hard for us to tell you who to look for that good information. So what we want to do is actually give you guys a practical example, because often people think, yeah, most of social media is bad, but the people I follow are really good. And it can be hard to tell who is really good nowadays. So we want to use actually a case study. So when we do this, we're not doing this to demean anyone, to make fun of anyone. This is how we would filter information. And we're taking a popular post to give you an example of how we go about doing it so that you guys can start using the same practice when you do go online and look at this information, because you are going to go on social media, so we can do it a little bit more responsibly. So I'm going to play this video. This video is from a very popular account. So the assumption is this person has some left shoulder movement and left shoulder pain. He's an elite weightlifter. Okay, so he's been having this nagging shoulder pain for months, and apparently his left shoulder has been found to move differently than his right shoulder. So this is leading to this individual to going, well, this is a movement issue of that left shoulder. That's why they are having shoulder pain. So they're going to do some soft tissue work first, right? They're supposedly going to loosen up some of these muscles. Then they're going to do an activation for his serratus anterior. We want to make sure the serratus is working. And then he's going to do an external rotation exercise for some stability and for focusing obviously on the rotator cuff and some of those posterior muscles. Now, so what happens after he does all these movements? Apparently his shoulder moves better and he's pain-free, right? So what should we actually take away from that? So for one is, I'd like a little bit more detail upon how did they determine that the shoulder was the root cause of the actual pain. While he had pain in his shoulder and maybe moved differently, what was actually the cause of this? Right? And we want to look at basically there were 3 interventions used. Were they all equally effective? Was one more effective than the other? And this is important because we're all trying to prescribe exercise, both in the gym and at home possibly, and time becomes an issue. So we want to know, were all these methods actually required? Did only one work, or did 2 out of the 3 work? And so we don't really know because we just did stuff and we're saying that they're better. Now, we have to ask some other questions. He's an Olympic weightlifter. In the upper body, he's bilaterally loaded when he trains. So why did just one side become problematic? That's something we'd want to investigate and ask the question about. I found out that this individual can put over 400 pounds overhead. Does that mean that his serratus anterior is not active and his rotator cuff is not strong? It sounds like he's getting a lot of strength from those areas. Otherwise, 400 pounds couldn't be put overhead. And then, of course, we want to ask, how long did these fixes last? Was this good for a session, a week, a month? Did we have to modify the actual training at all? So these are important questions when you're taking in information online that you should be asking yourself if you're going to use this as a reference point and resource to helping other people.
And something like the shoulder, we have to understand, it's hard to fix if you don't really understand how something works. And the shoulder never works in isolation. So something like the serratus works with the rhomboids, it works with the obliques and the opposite adductor. So we're taking into consideration that the shoulder actually works with the trunk and the lower extremities as well. And that was something that was kind of left out of that situation that Josh was explaining.
And we look at the nature of a sport. How do you not look at the ankle, the foot, the hip, and the core as relevant influencers of what happens upon the shoulder? So again, we want to know more. Was there actually screening of these other segments to actually assume that it was all from the shoulder, or was the shoulder really the victim or symptom of other things not working well? And we know this, and we've had this experience too, because we've worked with high-level lifters and other athletes. This is Mary, who we had the pleasure of working with a couple years ago. Mary came to us via Will Fleming because she was having chronic low back pain. Mary is an Olympic weightlifter who actually competed in the Paris Olympics this past cycle. She did an outstanding job. She's incredibly strong. She can back squat well over 500 pounds. You can see she can put 414 pounds overhead, but she was suffering from chronic low back pain. So we did a battery of simple screens. Okay, these are just two of them, but we did a battery of them, and we tried to correlate them to one another. So we wanted to see, because of her sport, how's her core stability? So here's an immensely strong athlete, so she should be able to do a bodyweight bird dog pretty easily. But as you can see, she struggles quite a bit. She rotates her pelvis, the leg kicks out to the side, she's x-ray rotating her foot. Now, I don't know at this point if this is the cause of her back pain, but it's definitely getting me to ask more questions. That is core stability an influencer in her pain experience? So then we also had her do something like a lateral step down. While this is a soft, cushion step, she's immensely strong. She should be able to step down without touching the other foot, without compensating that hip and knee movement. But you can see that she's actually struggling quite a bit. So you can see the wobbling in the foot. You can see the knee collapse inward. She has a hard time not touching down to the ground. So we started to create a correlation that some of these things like frontal plane stability, core stability, and other things were at the root cause of her pain. When we addressed them in her training, she not only became pain-free, but she was also able to hit some additional American records in Olympic lifting. So that's a really easy way to know if what you're doing is actually working. So you have to know the right questions to be asking. So there's other things that people do too. They try, especially on social media, try to say that if you're not doing certain things, like if I have back pain and I don't do heavy, rounded, loaded flexion, that I'm fear mongering. I'm putting people into more pain. That's not really the thing at all. We have to have a lot more nuance when we talk about pain. So there's lots of questions we want to ask. So for example, what is someone's past health history? If you take 5 people with low back pain, the root causes and the levels of their pain can vary immensely. So we don't say that everyone who has pain has the same type of pain or the same issues with their pain. You're going to find out that their beliefs about their pain are very relevant to their pain experience. Do they think of themselves as having a bad back, or do they think they're just in an acute stage and they'll be fine in a couple of training sessions? What is their current functional capacity? Meaning, like, how much can they do until they start to experience pain, right? Can they go for a 10-mile run or 10-minute run before they have some knee pain? Or are they able to run for 30 minutes before they have knee pain? These are questions you want to find out. And I ask these questions with people all the time. And our structures are all different. So our tolerances to these different stresses are overall much, much different. So again, it's asking the right questions and we're understanding really what we want to see in improvements of people's pain. Because I did, just in case you were wondering, did find a study that compare people with chronic low back pain doing flexion-based exercises and extension-based exercises. So the top black line was the group doing the flexion-based. They started off with a pain level of about 5.86 out of 10, so kind of a very moderate level of pain. After 3 months of doing flexion exercise, they dropped 8 points. Not very much at all. I mean, you can drop a point in your pain just depending upon the day it is. So there really wasn't much of an influence over whether or not you flex your spine or not. In fact, they continue to have the same type of progress 9 months later. So again, a lot of these things aren't as effective as people say or proclaim because there's not a lot of evidence to show that these are actually the root causes of people's pain. And oftentimes it's sad because when you try to engage with people in having a more nuanced discussion, it sort of defaults to, but it worked for me. And while anecdotal evidence can be useful, without context and awareness that there's many variables at play that people don't standardize, it's just not a good enough answer to actually prescribing solutions for other people and what they're dealing with their pain.
Oh, sorry.
Jessica really likes to talk about this, but I'll jump in first. So, one thing that is really important to understand too, when we're talking about this, especially when we're talking about things that may not make a lot of sense, but people get benefits from, is that placebo is a very strong element of how much effectiveness something can provide. They find a placebo can act up to actually a 50% reducer in people's pain. Now, that's not a bad thing, and it doesn't mean people are making up their pain, but it does mean that we should be harnessing that as much as possible, and it does explain why certain people will have really good results with certain strategies, and other people's will not, because the belief system in those different strategies play a big role in them.
So this is kind of the power of placebo. These are some interesting studies that you don't really typically see due to ethical considerations because these were placebo-based surgeries. So this first one looked at patients with osteoarthritis affecting the knee, and they did a placebo surgery versus an actual surgery. So they went under anesthesia. They still got surgery, but that placebo group didn't really have anything done. They still made the incision. They just didn't do anything, closed them back up, and that individual thought they had the surgery versus the other group, they might have had a cleanup, meniscal repair, or something like that. And they found very similar outcomes when they were talking about pain scores, which is really interesting because the belief of having that surgery that was going to fix your pain actually worked. And they did this with spinal surgeries as well. And again, they don't typically do these. So this was really interesting to see. It was a sham spinal surgery. Again, the outcomes, there was a decrease in pain levels for surgeries that didn't actually happen. They just thought they had repair done to the area that was painful. And that's oftentimes the same thing that happens with a lot of injections that you see with spinal injections that follows the same route as well. People believe it's going to help, so therefore it does. And placebo can be a really good thing.
And if people don't believe in something can work, it's going to harm its ability to actually work as well. And so to really highlight how powerful the brain is, I thought we would give you a couple more examples that really demonstrate like we need to consider how people are perceiving what's going on in their life. So Dr. Ellen Langer is a mindfulness researcher at Harvard. She's been researching mindfulness for over 40 years. She's published over 200 studies. She's got actually some very famous studies in regards to mindfulness. But one that was really, I think, of interest here is what she did on chambermaids. So women that would typically clean hotel rooms. So this is a very physically demanding job. They spend all their time going to these rooms and cleaning them. Now, these women don't typically think of what they're doing as exercise, even though it is physically demanding and they do it for long periods of time. So what they did is they took 84 of these chambermaids and they split them into two groups. One group, they just allowed them to continue to do their typical day, nothing else done. The other group, they did the same work, but they also got education that what they were doing was going to provide health benefits and was physical exercise for themselves, that they were going to see potential benefits from this work. And just after 4 weeks, they found that the group that got no education didn't see any changes in their health measures, but the group that did get the education saw decreased weight, decreased blood pressure, decreased body fat, and so forth. So they actually saw positive changes. This is really important because how many times do we hear people think they're not doing enough? They should be doing more. They just are not training hard enough. So our way that we relate to the activities that we do and the situations we are in can actually change our physiology as well. This has also been really interesting because they also did a really interesting study on fatigue and endurance. So there's a particular gene that they found that if you have this gene, you're more likely to experience fatigue and have decreased endurance. So what they did is they took about 120 young and middle-aged individuals and they did the gene test on all of them. But then they did something kind of sly. So for the people that did have the gene, they told half of them that they didn't have the gene and half of them that they did. And for people that didn't have the gene, they told half of them they did have the gene and the other half they did not. And what they found is irrespective of actually having the gene, being told that you did have the gene for fatigue actually caused people to have lower endurance than actually having the gene itself. So for all the people that go, oh, it's my genes, my genetic makeup, the belief and the power of that information seems to be more impactful than potentially even the genes itself. That's why, again, things like pain require a comprehensive multidisciplinary approach. There's not one thing that often will solve everyone's pain. So we have to be careful about looking for an overly simplistic solution for people's pain and helping educate them on what they need to consider that actually is evidence-based and can profoundly impact their levels of pain. So for me, this was a wake-up call several years ago at a Perform Better Summit, and we were doing the Q&A, and there was a coach that raised her hand, and she said, hey, I have this client. He just lost his dog. He just lost his wife. How do I fix his thoracic mobility? He's really rounded. And I didn't know where that was going for a moment. And I just thought to myself, and listening to everyone give answers, no one addressed the fact that this person just experienced some huge emotional stressors. Think about when you lose your favorite pet. And then you lose your significant other, like you start to sink and you start to fold. The fact that we have this disconnect between mind and body is really a problem in how we help people address a lot of their chronic pain issues.
All right. So what really is corrective exercise? Because we're going to talk about corrective exercise in a minute. And these are all great definitions. I've even been asked to define it on podcasts and different mediums. So let's just take a look. Fix movement compensations and imbalances. That's a good definition. Fix movement patterns, strength functions, and imbalances again. So all very kind of similar, improve the quality of motion. So these are all great definitions of corrective exercise. But what you notice is that not one single one of them say pain reduction. And that tends to be the case when we're talking about corrective exercise. We don't really say that it's there to decrease pain. So pain and function are not always related, and I can help someone improve their function. It doesn't necessarily mean that I'm going to see a huge reduction in their pain. Sometimes, of course, yes, like if we improve function, you can see a decrease in pain, but not always. And usually when you get surgeries as well, you're thinking that, okay, if I fix the structural issue, that I'm going to see a decrease in pain. And that's not necessarily the case either. They don't always go hand in hand. And then when people say this is the cause of your pain, we have to kind of ask these questions. And I see this all the time. So strength being one of the bigger issues when we talk about pain. Maybe you're just weak. Well, how did you know that muscle was weak? We have to ask these questions. Are you testing this? Do we know that this was a cause? It's very difficult sometimes to pinpoint the cause of chronic pain. Mobility. Everyone's like, you need more mobility. But how are you measuring this? How are you making note of how much mobility an individual needs? Breath compensations cause pain, or did pain cause these compensations to occur? And most of the time when I'm working with individuals with chronic pain, there is some breathing compensations going on. And typically when you're in a heightened state of pain, you're going to see that with individuals. And Josh has already talked about, does the impact of the exercise last? We have to ask all of these questions that you see here. So what are we going to do? So let's kind of dive into some of the things that we're going to talk about and just kind of, we're going to skim the surface. Remember that this is not a super long webinar. We just want to get you guys quality information. So when it comes to core training, I don't know why this is a thing now, and I keep seeing it on the social media. Even physical therapists, they're bashing core stability training. Like it's a funny thing now. Oh, I bet you're giving core stability drills. So what does the research really say? So core stabilization programs have been shown to significantly reduce chronic low back pain by 39 to 76.8%. That's a huge percentage. It's non-invasive, really. So why wouldn't you try core stability to help decrease someone's complaints of low back pain? And there's a big discrepancy. I get it, like 40% or 80%. That 40% really came from 8-week core stabilization on unstable surface training. So that's where you saw the lower percentages. But the one that had the higher percentages was kind of your traditional core stability drills, like the McGill Big Three, which for right now, it's kind of a cool thing to do is to bash those, which doesn't make sense to me because there's a lot of research behind those. And if you can get a 76.8 reduction in low back pain, why not try those? Now, core stability does a lot more than we think, more so than just helping low back pain as well. We're seeing a reduction in knee pain. We're seeing a reduction in shoulder pain as well. So core stability can really help when it comes to chronic pain. And then stretching, that's controversial too. So to stretch or not to stretch, what does the research say? The research says it helps. This was just a 4-week intervention program. Back pain significantly improved by 58%. That's substantial. When you're in a lot of pain and you can get even the slightest reduction, it can change that individual completely. It'll allow them to do a little bit more. So why not add in the core stability and the flexibility? This other one looked at a 12-month stretching program was as effective as strengthening and manual therapy. And this is something that's easy for people to do, a stretching program, a consistent stretching program, where manual therapy and a strengthening program may not be. So other variables as well, when we're talking about mobility, how can we improve mobility? They found that something like myofascial stretching, or similar to that photo that you see where we make those connections between the upper and the lower quarter of that entire kinetic chain, we start to see improvements in mobility, such as at the hip. And then we also see improvements in mobility from core stability as well. So core stability can be very beneficial, not only reduction in pain, but helping with mobility. And then we also see improvements with something like diaphragmatic breathing that helps with mobility as well, and postural stability. So all of these things can be beneficial, but yet these are things that people tend to kind of go, oh, these are silly, these are stupid, I bet your PT is giving them to you, because they actually do work for a lot of the people.
And I think too, like we have to understand that sometimes it's people mistaken what the problem actually is. Like, if you don't move well in your shoulders, people assume that's a mobility issue. But research has shown, training like PNF patterns, going through these diagonal patterns, actually restored shoulder function actually better than actual shoulder mobilizations did. We see that hip exercises can help reduce chronic low back pain. We see that people who have low back pain alter how they move, which makes sense. Anyone who's ever had pain knows that you start to move differently because it hurts. So it's really frustrating sometimes when people try to evaluate what's going on with someone who's in pain, especially from a distance, and going, well, they need more mobility because look, they're contorted. Well, yeah, they're contorted because they're guarding, they're in pain, or a muscle is weak. Yeah, it's weak because the area of the joint is in pain. It doesn't mean that was the cause of the pain. And I think a lot of people are misunderstanding what the root cause is, and they're treating the symptoms and not the actual problems. So as much as all these things are useful, right, especially if you believe in them to be useful, you can use them as tools. However, what is a problem is when people become over-reliant upon external ways of addressing their pain. And I've seen people, and we probably all have had those clients that feel like they have a little twinge or something. They're like, I got to go see my chiropractor. I got to see my acupuncturist. I got to go see my massage therapist. And what ends up happening is they become dependent upon these things. And if they kept working, that would be one thing, but they often don't. And when people stop having the results that they initially had, then that they get back into that despair type of situation because they're not really understanding what the root cause of a lot of their chronic pain issues stem from. These are more Band-Aids over the bigger problem. So we do want you guys to understand not only what you believe in the treatment really matters, but also what you believe about your pain really matters. The more you believe that you're broken or that there's something really wrong, the more likely you are to feed into your chronic pain symptoms. And we'll go over how that actually works. And oftentimes this leads to a lot of people putting out the wrong fires, right? They try to find out the small little things to keep putting out instead of the actual major fire. If you kept leaving your stove on and your house kept burning down, you'd eventually want to turn off your stove. But a lot of people don't even realize that the stove is even on. So we want you to have a better understanding of pain, which is something that a lot of people, especially in our industries, actually don't have. So if we go to the International Association for the Study of Pain, they have a very relatively simple but complex definition at the same time, meaning that pain is a sensory and emotional experience. So again, both things impact people's experience of pain. That's just hard for a lot of people because a lot of times when something hurts, both the person experiencing the pain and the person trying to help that person in pain think that it's all structural, and you'll find out it really isn't. Because in 90%, especially chronic low back cases, so these are people with pain for greater than 3 months, 90% is considered non-specific, meaning there's no structural issue nor any disease process that is causing pain. So when people think they have a bad back or their herniated disc from 15 years ago is still the cause of their pain, percentage-wise and most likely, it is actually not the cause of their pain. That is why things like core stability and stretching and other things can help, but there's a bigger understanding that we have to possess as well. So this comes into where actually this new term of nociplastic pain comes in. And we have to be really careful about this because I've tried, when people come to me and they ask me what they should be doing for their pain, I explain some of these things and I try to be really careful in the explanation. It can still go awry, where nociplastic pain is basically where your nervous system starts to misinterpret signals going on in the body and creates pain, even though there's no structural damage going on. Now, this seems crazy, but we'll explain how this goes on. And this is far more common with people in chronic pain than most people realize. This does not mean people are making up their pain. I want to be very clear about that. The pain they're experiencing is actually very real. It's just not coming from structural damage because all pain is real and all pain is created in your brain. So I like to lean on my favorite chronic pain expert, Yoda, here. We have to sometimes unlearn some of these biases we have so that we can actually see the bigger solutions that we can provide people. So I like to encourage people to have that beginner's mindset of where a lot of things can be true and multiple things can be true at once. It doesn't mean one thing is the only cause of someone's pain. So I know this for myself. A lot of you have heard my story. But since I was 14, I've had low back issues. I herniated 2 low back discs when I was in high school playing a basketball game. Doctors found a very aggressive degenerative disease at the same time and said I was going to have problems all throughout my life. And they were right. And there were periods where I thought I had the answer, and then there would be followed by periods that I was in immense pain. And it all came to a headway several years ago when basically in a 9-year period, I had 7 spinal surgeries because I lost the ability to walk. I couldn't use my arms. I had migraines that were so bad I couldn't even get out of bed. So when you have that type of pain level for that extended period of time, that's a great example of how your brain can learn to be in pain. And it was actually Jessica who brought this to my attention. I'll let her explain just a little bit about it, and we'll delve a little bit deeper in a moment, that I was struggling so much, not just with the physical pain, but everything that comes with it mentally and emotionally, the drain it makes, the inability to do things that you enjoy, inability to see joy in your daily life. It's hard not to be depressed and fatigued when you're experiencing constant pain in your body. So what did you tell me at the time?
Yeah. So, I mean, just going through that sheer number of surgeries in that small amount of time. Well, I guess it wasn't a small amount of time. It was like 8 or 9 years, just being in that constant state of pain. Like Josh said, your body learns to be like that. So I was, finally after, I don't know, after like the last surgery, I was like, I think you're stuck in this pain loop. Your body just doesn't know how to not be in pain. I think it's just comfortable. I don't even want to use the word comfortable. It's just familiar, right? So surgeries are traumatic. There's lots of pain and healing that goes on. But then once you have more and more surgeries, you just get stuck into this constant state of pain. And that's what your body is used to after so long. And it does become hard to break.
And a lot of people with chronic pain are actually suffering more from the things that it limits in their life and their emotional experience than they are the actual physical pain. And what also makes it difficult is a lot of people have a hard time interacting with people with chronic pain. This is my images. Like that's my neck on the right and that's my spine on the left. And they are consistent with my pain symptoms. And most people don't know how to treat me. Like they think I'm a glass, but they also want me to do everyday things. And people go, why aren't you better? And why are you tight? And I think a lot of times our society in general has a really hard time interacting with people with chronic pain. We tend to think people are making it up or they're being overly dramatic or why can't you just do something about it? And this all actually feeds into people experiencing worse pain as they go on. Because we think pain works like this. If you were to step onto a fire, that you're going to get that sensation from your foot and you have pain. That's actually not how it works. If you stepped on some fire, your body would send those information up your nervous system and your brain would have to decide if it wanted to create a pain response. But that's dependent upon other things like what is your experience with pain and having on the fire? Maybe you have a shoe on there that you don't even notice and you don't get a lot of fear from, even though your foot is on fire. Maybe you're focusing on something else that's more important and more dangerous. What if someone's coming to attack you? You may not actually feel pain because your brain will decide to prioritize other sensations and other things that can be more damaging to the body. The type of state you're in, if you're different emotional states or your sleep and other things, all dictate whether or not people actually end up having pain from the experience. Because I'll give you an example. People think this is like, nah, this isn't true. How many times have you been in the shower, you look down and you notice a cut or a bruise that you don't know where it came from? And you're like, I don't remember having that happen. Where did that happen? So you had structural damage occur, but you never actually experienced pain. So there's lots of things that influence your pain experience that I don't think people really understand. That when I say all pain is created in the brain, it doesn't mean you get to choose to have pain or not. It just means there's lots of influencing factors that determine whether or not you actually end up having pain. A great example is when people go in and they don't like getting shots of the needles, and if they're going to get their blood drawn or they're going to get a shot, and they pull away and they think they're going to have pain because your brain is predicting that this is going to be painful. Some people actually experience pain before they even get the shot. Right. So we see so many examples of this all the time that the brain is actually predicting pain based upon past experiences and context of certain environments. This is known as predictive coding. So your brain is a predictive organ. So the way it regulates your body, the way it understands what's going on in the world is based upon past experiences and sensations it's getting from your body to determine what is actually happening. And so it learns, as Jessica mentioned, based upon these past experiences, what it should do. For example, if you bent over at one point and really hurt your low back, your brain may learn that bending over hurts your back. Therefore, anytime you even start to bend over, it will create pain in order to protect you from doing the thing it perceives to be dangerous. Because they're finding out more and more the neural pathways that are used in the brain to create physical pain are very similar to those that deal with emotions and stress. So what can end up happening is they can get kind of intertwined, where emotions and emotional stress start to come out as physical pain. And that sounds like hooey nooey and new age stuff. Think about it. Have you ever been stressed and you've started to get a really tight neck? Have you ever been really nervous and gotten butterflies in your stomach? Have you ever gotten really excited and your heart starts racing? We know that mind body are interconnected, and much more than a lot of people actually realize. So this is why we tend to use this biopsychosocial model, where this was developed in the 1970s by doctors. Some cultures have been using this for thousands of years, that our biology, our psychology, and social influencers all determine our experience with pain. This was actually brought up at a Harvard Medical School symposium I went to several years ago on whole person health, where they actually explicitly talked about how to use this biopsychosocial model. So this is going more and more into the medical field. And if we as fitness professionals, strength coaches, and even therapists don't understand the role of the biopsychosocial model, we can't actually help people to the extent that we want. So I thought a good example of this was a news story that came about. And because we are all animals, I thought this would illustrate that a lot of the issues that we do experience are not really the cause of what we think. Now, I think I have to take off our mic just for a second, just can unplug that so you guys can hear the words, so you guys can hopefully get this anyways.
The aquarium in Japan temporarily closed for renovations in December. This sunfish stopped eating and started rubbing its body against the tank. The staff thought the fish had developed digestive issues or was infected by parasites, Japanese newspaper Mainichi Shimbun reported. But it turns out the answer was much simpler. It was lonely. The aquarium noted the animal's curious nature. It would swim up to the front of its tank whenever people came to visit. So the aquarium set up makeshift visitors by taping clothing and cutouts of faces to the tank. The aquarium says the sunfish was back in good health the very next day.
So I know we're not fish, but we are all animals, and we do have similar experiences. They estimate about 90% of visits to a general physician are related to chronic stress. That's things like digestive issues, sleep issues, depression, anxiety, chronic pain, headaches and migraines, and more. So again, we have to understand how this system all intertwines. So this also correlates to a lot of interesting research done on adverse childhood experience work, where they find that people who do score higher on adverse childhood experiences end up being more prone to being people with both chronic pain and higher obesity levels, because it makes for a more complex and more sensitive nervous system.
Now, you can have stress. Usually it's not just one thing, right? That'll stress you out. It could be your commute. It could be your boss. It could be all the doom strolling. I can't even doom strolling. Sorry. But usually it's a lot of other factors that kind of all come together and then cause this elevation in stress levels. And there's a lot of conditions that kind of fall under this nocioplastic pain as well. So you've got conditions like fibromyalgia, even menopausal symptoms, memory problems, fatigue. Obviously, we've already talked about chronic low back pain, tension headaches. All of these things can fall under that nocioplastic kind of umbrella. And then, this doesn't help either, because this is all over social media, because we keep seeing all the things that we need to do, from getting our 10,000 steps in, to our meditation, to our saunas, our cold plunges, getting our sunlight, and all of this stuff that we're supposed to do to help with our stress. But knowing that we're not doing it, or we can't get it all in, is stressing us out even more. These lists keep getting longer and longer every time I pop into social media. So this can be a stressor in and of itself too. If you know that you can't do all of this stuff, then what?
And that ends up leading to a lot of people feeling like they're failing. And a lot of people fall prey to their own self-critic. We all have our own self-critic. And what research has found is the more critical we are of ourselves, the more likely we are to create pain type of related symptoms, or make our pain symptoms actually worse. This was actually something we experienced last year at Perform Better. There was a coach came up to us after our presentation where we were describing some of this. She described to us that she had been in a car accident a few years ago, and she was still in chronic pain. And she was saying that she should be better now. She should be better. And I asked her, why? Why should you be better now? Where is that coming from? And it didn't take very long for her to get very emotional about the whole situation. I could tell that she was being very critical of herself. There were reasons outside of herself that were causing that, but it was all perpetuating her to actually being stuck in this cycle of pain. And so we can look at certain qualities, like what we do with that. If we see certain personality qualities, these have all been related to people that seem to get stuck in these pain cycles more and more. Things, and you can see things that people say to themselves. So you can be aware, are people saying these things? Do they have these type of personality traits? These are all people that are very prone to that nociplastic pain, and having that nervous system keep them in pain in the long run. Because basically pain is a danger signal that the brain creates, but it creates that in response to multiple things. You can have structural damage, but not always. You can have a very stressful or emotional situation that's causing it. And so what oftentimes is that they find that people that fall in the trap of what they call the 5 Fs are people that keep perpetuating their chronic pain cycle. And it's understandable why people do these things, but we never help educate them and understand why this becomes damaging. They focus on their pain all the time. I've done it myself. You try to, you're just consumed with your pain. You fight against the pain. You're like, I gotta get over this. I'm gonna work against this. I'm at war with it, which only creates more of a danger signal to the body. You fear the pain. It's understandable that you fear what this is going to do, not only to you physically, but to your life and your relationships. You're constantly trying to fix your pain, right? You're going to different appointments, different modalities, different professionals all the time. I mean, I've literally had times where I lost a whole week of my life trying to fix my pain. So I get it. But again, that's causing more of the danger signal to being reinforced to the body. And that obviously causes people to be very frustrated. So all these Fs reinforce to the brain that there is something dangerous and something that needs to be addressed, which perpetuates the pain. So a lot of you have probably heard the old saying, pain is inevitable, but suffering is optional. Someone almost made this into a math equation where pain and times resistance to that experience is what causes the actual suffering. So the way we relate to pain is often a big determining factor upon what type of chronic pain experience people actually have. So again, the more that, especially the emotion of fear that people have about their pain, not just it's hurting, but what's going to do to their overall life, keeps them in a perpetual cycle of pain. And it's not just fear, because it could be also anger, frustration, hopelessness. All these, if we don't break that cycle, keep people in pain. So I said, Yoda's right. I got to work these in, Jess.
You love Yoda.
Yoda is the best chronic pain expert. So it is really the path, the dark side, right? And it's okay to be fearful. It's okay to have anger. It's okay to be frustrated, but it's when you're stuck in these emotions for the long run and you don't know how to handle them that it keeps perpetuating the problem. I give it like these, the Chinese handcuffs. The more you try to pull apart, the tighter it becomes. That's a good analogy for people with chronic pain. You have to actually let go of the control to actually get your fingers out. Now, I'm not saying you're just going to think your pain away. That's not what we're suggesting. We're going to give you actually some practical strategies. And there's going to be several tools that we go over. We already gave you some exercise tools. Exercise can be very helpful, but how we relate to exercise too. If we go into exercise thinking like, this is going to fix my pain, this has got to be the thing, you're putting a lot of pressure that's going to make it less likely to actually be helpful. So when we give you guys these tools, it's not that everyone's going to use each of these tools. You're going to have to know the right person, the right time to use them, but they're very, very powerful tools. Now, we're going to start with something that probably everyone's rolling their eyes at, which is mindfulness, right? But mindfulness is really poorly understood by most people. I know I didn't really understand it either. Dr. Ellen Langer, points out very easily that mindfulness doesn't mean meditation. Meditation can be a form of mindfulness, but mindfulness is basically just noticing new things. Like what? Like, hey, what are the sensations that I'm experiencing? Do I even notice I'm calling sensations pain? What type of emotions are coming up and what type of stories am I telling myself? And from that, we can use various different types of mindfulness to actually help people with their pain. But I know a lot of people are going to be like, I can't do this. There's no way I can do this. So Jessica's going to give you a really easy, practical example of how you can start teaching people mindfulness.
So this is a great place for everyone to start. I mean, if you see that stat, 262 times a day, we're reaching for our phones. And I'm willing to bet it's probably more than that. And we know no one is reaching for their phones to talk on them. So we can be a little bit more mindful as the reason why we're reaching for our phones, why we're looking at our phones. Do I really need to open that app? Just being really mindful of the use of your phone can be a really good starting point to have more mindfulness. I think that would be an easy way to start and kind of understand what it is that we're talking about.
Yeah, it's just awareness of what you actually are doing and why you're doing it and how you feel when you do it. Because most people, when they go on their phone, they're going on social media. And social media is very deliberately trying to get those emotions of anger and fear triggered in you because it gets better engagement. But also we know those are the things that keep you in pain. So you have to ask yourself, do I feel better or worse when I go on social media? How do I feel when I use my phone? Why am I picking up my phone, like Jessica said? And being aware of these lifestyle things that we can modify to actually help people calm down their nervous system. Because if we keep going to these things, we're going to keep running into a circle where we don't actually get them out of their pain. And there's plenty of research that shows that mindfulness actually changes the structure of people's brains. And we talked about that it's the brain that really we have to concern ourselves with when we're talking about chronic pain issues. It changes for the positive when we're dealing with more mindfulness in our lives. So one example is what's called somatic tracking. So a lot of times when people want to do the heavy rounded lifting for people with bad back pain, they're trying to use exposure therapy. Like, have you ever heard people are scared of spiders, so they try to be around a spider, right? But what people don't understand about exposure is that it has to be progressive. It has to be related to the individual, that if you give too much exposure to someone, it can actually set them back quite a bit. Like if you had a fear of heights and I put you on a tightrope on a giant building, it's probably going to make your phobia of heights far worse. What somatic tracking does is uses mindfulness, so awareness of the sensations of the body. So can we start describing what those sensations are like? Is it cool? Is it burning? What does it feel like? Can we stop calling it pain and start calling it a sensation? Not calling it good or bad, but just experiencing what it is. So when people say be curious about it, I use the analogy of like, have you ever gone to an aquarium and you're looking at like, hey, look at that fish. It's that color and it's kind of a different shape. That's what we're trying to do, which creates distance from the I'm in pain, which actually has been shown to help reduce pain sensitivity. So again, we're not trying to change the pain. We're trying to give people a different approach with their pain. And as we do this, help people realize that they are in a safe place, even though they're experiencing sensations that are uncomfortable. So they're not in danger, because one of the biggest things we have to do is teach the nervous system that they're not in danger. If they're not in danger and they understand they're not in danger, they're less likely to create pain. And we want to do this with a positive mood. We want to try and invoke some fun into it and some lightness to it, so people don't take this so seriously and think of this as a giant chore and make it more of a hard thing for their nervous system to adjust to. So something I do that Jessica finds funny is I love the movie Old School, with Will Ferrell, and he's Frank the Tank. I'm dating myself a little bit, but so when I would have really strong sensations come up, I would name it Frank the Tank. And that lightness and then exploring it would actually help me lower the pain. I wouldn't go into it trying to lower the pain. I'd go into it trying to understand, what is Frank the Tank trying to tell me now? Maybe I'm working too much. Maybe I'm tired and I need to rest. What is he trying to tell me by creating these sensations? There's a lot of research of how powerful somatic tracking can be. You want to do it when people have more moderate levels of pain, not when they're in super high levels of pain.
As a clinician, I really wish that we would go more this route. I think we're forced to constantly ask people about their pain levels, their pain scores, and then they're super focused. They become very, very focused on their pain. When you're like, hey, can you rate your pain 0 to 10? Where are you having your pain? I wish we could go more of this route where we can just talk about, hey, this is a sensation that's happening. It's not good. It's not bad. And go more of this mindfulness route versus trying to document in a way where we're just focused on someone's pain all the time.
Yeah, the difference of what Jessica just explained that she has to do as a clinician versus what I was saying is mine was to describe and be aware of the sensations. Hers is asking you to make a judgment about them, which actually perpetually puts people into more pain. Something else we can do to help people if they're having a hard time really accepting a lot of this is help them gather evidence. So research shows that a lot of people in pain think their pain is bad all the time. But the reality is it's not. They've actually tracked people throughout a day, and the pain actually varies quite a bit. And if you can show people that their pain varies, number one, you can help some of the fear factor of it, helping them understand they're not always in bad pain. And when they're having a moment of these really intense sensations, that this will pass and they will get to a point where it gets lighter. Does actually help people or help them understand now we have evidence that you aren't structurally damaged, because if you had structural damage, you'd always have this level of pain. It wouldn't get lighter and heavier depending upon what's going on in your life. So you can help people with journaling and other things that help them understand what is actually causing their pain. And a lot of these strategies are rooted in what's called pain reprocessing therapy, which had some interesting research published in JAMA, which is one of the most prestigious publications. And they showed that people who had 10 years of chronic back pain in 4 weeks of using some of these strategies, over 66% of the people were either pain-free or nearly pain-free. That's unheard of in pain research. And they were able to maintain that well over a year time frame. So imagine how much effectiveness we could have for people using these strategies combined with smarter exercise. Because there's an old saying, the neurons that fire together wire together. The more you focus upon, the more you're solidifying in your nervous system what it defaults to and what it predicts. If you're always going to, this is the worst thing ever, I can't deal with this and all that, you're reinforcing that to be the default mode of your brain. If you can teach it something else, you can have a profound impact the other way. So one of the ways we can do this also in the gym are mind-body practices. There's way too much evidence and there's too much of a need to deny that these practices have to be used at some form or another in your training program. They might be in warm-ups. It could be the core of what you do depending upon the individual. They could be part of a cool down, but they need to be part of your programming. And we've been teaching our myofascial integrated movement system as a version of this, but whatever mind-body therapy you do, you have to actually probably have it at some point in your program. It's different because the focus on deep breathing, the mindfulness, the trying to soften the body are all related to actually improving pain symptoms far more than even other forms of exercise. And this example I used last year at Perform Better in Los Angeles. This gentleman volunteered. He had some back pain and discomfort. That was his hip extension that he had. We actually had to fix it because he was using his knee there. So there was neither good, bad, or different. We're just showing where he started at. So then I took him through a very simple MIM drill. Some of you might notice this is very similar to a Tai Chi movement, but we gave him some very specific instructions about paying attention to how he was breathing. Not trying to get very specific, just what did the breath feel like? To use the breath to lift the arms, to focus upon feeling pushing through his feet and then sinking into his feet. We only did about 6 to 8 repetitions of this, so it's not incredibly time consuming. This wouldn't be the only exercise I would do, but this was an example. So then we retested him. Let's see the change in his mobility. Huge change in mobility. And just as importantly, he said he had no back discomfort after that point. So this is, again, another way we can regulate the nervous system, but we can do so through deliberate exercise. It's how we approach the exercise that's really important too. These type of training strategies have been shown to reduce things like catastrophizing, which people do all the time. Oh my God, this is the worst. This is going to be bad, so forth, things like that. Fear movements, so the kinesiophobia, like I'm fearful to use my body, which perpetuates more pain. Also, they've been shown to be anti-inflammatory because of the regulation of the brain actually causes a decrease in inflammation throughout the body, which improves the brain's ability to predict and overall things like myofascial pain and other sources of pain. So you don't do this once or twice and you're fixed, right? It's like going to the gym, right? You can't go to the gym a couple of times and go, I'm buff now. This is a constant practice. It has to become habit. And the reality is success is not going to be always a linear manner, right? You're going to have some good times and you're going to have some bad moments, but it's understanding how to relate and use those bad moments to reinforce your practice. So it's about building consistency, but using simple strategies that aren't overly time consuming and that you can utilize in your gym and teach your clients to do so on their own. And we have to stop focusing so much on the outcome. Yes, overall, our goal is to reduce your pain. But if you do everything, whether it's the exercise or your diet or your massages or your treatments or what we're talking about now, with the goal of actually solving your pain, research has shown that doesn't create a conducive environment to reduce that danger signal and help the brain to stop creating pain. And we have to be compassionate to ourselves. So again, the less of a critic we are, and the more we understand this is difficult. This is challenging. This is not easy. It's okay. I'm trying my best. Actually, has been correlated to reductions in pain rather than trying to push yourself through it. Trying to be a warrior and things like that are less productive. So there's lots of things we can do in people's lives to help calm that nervous system. Simple things we can do. For example, if you know that people like a certain songs, that you have a playlist going that can lift their mood when they're feeling a little down. It may not solve all their pain, but it may change the pain to being a little lighter, not so overwhelming. You notice that people tend to speak really fast and really loud when they're really aggravated. So if we can slow down our speech, if we can sort of just slow down everything we're doing, we can actually find very simple ways to bring awareness of people reducing that stress to the nervous system. So this is stuff that we're all going to dive deeper into our 6-week online masterclass. So I'll turn it over to Jessica to explain a little bit of how it works.
Yeah, since this is such a big topic, we thought it would be great to do a 6-week masterclass on it. This doesn't start until April 15th. It's if you've joined us before for some of our other masterclasses, we meet once a week for live sessions. This time it'll be on Tuesdays at 2 p.m. Eastern Standard Time every Tuesday. If you can't make the live sessions, that's not a problem. You'll still receive the recordings. We do highly recommend following along with the content as we go through the week. So if you can't attend Tuesday, then hopefully you can catch up on the other days of the week. We'll also have continuing education credits through NASM. I think they're going to be about 10 contact hours. And each session, if we're doing exercises or any resources, you'll receive handouts and PDFs of all of those. You'll also have access to a Facebook group as well if you want to have even more communication. But each live session actually will have a Q&A session that's been pretty popular as well. We'll usually stay on for 20 or 30 minutes answering questions and just having more interaction. So we're really going to dive into chronic pain and go over a lot of the things that we kind of just breezed upon in this 1-hour webinar. And we're going to dive much deeper into a lot of these things.
And I know Perform Better will be sending out more information as well. And if you guys have questions, you can go through our email. I know you guys will be directed towards Ultimate Sandbag Training. Don't worry, this is not just an Ultimate Sandbag program. We're going to use lots of different tools, lots of different methodologies. So we're going to have an opportunity to give you a more well-rounded, holistic approach to helping people really reduce their pain and give them an evidence-based approach.
And we're happy to stay on and answer some questions. I know I can kind of see a little bit of questions in the queue there. So we're happy to stay on and answer everyone's questions. Hopefully you guys enjoyed this webinar.
Can you define chronic pain and how it differs from pain that is not chronic? Of course, there's acute pain, but there's also something in the middle. Actually, chronic pain is defined as pain that goes on for greater than 3 months. And what they typically find is that the brain actually starts to change. You get to see changes in things like gray matter, neurotransmitters, different neural pathways. So again, there's actually significant changes in the brain that occur as you get into a chronic stage. There was a study done by Northwestern University. They had people who had acute low back pain. They were able to determine up to an 85% accuracy who is going to develop chronic pain from brain imaging, not spinal imaging. So that's really the definition. It's either usually chronic or acute. If we believe someone's overly relying on various modalities, how do we help them? Psychological consult, what are some suggestions to help them understand? Well, first is to ask them, like, do they think it's working, right? If you have something that you really believe in and you like, there's no reason to stop them from doing it. If they're getting frustrated that they're no longer seeing success from it, that's where we can start introducing some other information, saying, hey, are you open to me giving you some information about why it may not be working for you as well anymore? And starting that relationship, because Jessica can attest to it, like, you need to be really sensitive about a lot of this stuff, right?
I would say pretty much all my chronic pain patients have cried to me more than one occasion. So you do have to be very sensitive and you have to take kind of baby steps. So you can start with things like, maybe kind of understanding stress levels or stressors in their life. Maybe, at another session, we can understand a little bit about their family history or their childhood, things like this. But I don't want you to have to ask all of these tough questions at once. Some of these questions come about after working with individuals over time and just kind of really understanding what's really going on in their life first and understanding that aspect. And then, like Josh said, asking if they're doing all of these modalities, are any of them working? Or are they just kind of giving you temporary relief and you feel like you're not really getting anywhere? You have to ask these questions.
And sometimes you may want to ask, can I go over the information with you? Because they may watch a video or read a book that you suggested them, but it may strike the thing where they think are you saying I'm making up my pain? Or they may misinterpret what the information is actually saying. So sometimes going over a short bit of information with them can definitely be a way to help them understand better. You can offer free seminars at your gym that they can come to with other people. Maybe they can open it up to talk about things about chronic pain that people are often missing and not aware of. And so you can make it more of a community event as well. And it's a way to have social interaction too and build community with your gym, which is really, really helpful. So how do you shift that focus? I'm going to make a guess. You can chime back in if you want, if you're still around. I think focusing on the pain is what you mean. I think one is trying to teach yourself to not call it pain, but just to say there's a sensation going on. And the sensation is uncomfortable right now. You can say that, but it's hard to describe it. Like, there's a sharp, dull ache. It really bothers me. Okay, well, you know it won't last forever because you didn't have it maybe 10 minutes ago, and you know it does fluctuate throughout the day. You can also look at it, you can start investigating. Why did this come about? Well, did I just have a fight with my spouse? Did I just have a really tough client? Did my boss say something nasty to me and now my pain is elevated? Because if you can start focusing on the emotions around those situations, oftentimes you can find that you can change the level of the intensity of that pain. A lot of times people that when they get very emotionally activated, you don't actually have to address the situation. You can find where in the body that they're feeling their emotions. And when you try to soften and you try to change that relationship with that physical sensation, it actually changes the mood as well, because it's not mind and body, it's mind body. So again, they're totally very much interconnected. Thank you. Is it free? Oops. I've known several acquaintances who have jumped into surgery in an attempt to eliminate or mitigate their pain, sometimes with disastrous consequences. Do you have suggestions for broaching the topic of alternatives to surgery without overstepping? I'll turn that over to Jessica in a second, because you do have to be very careful, because you are defaulting the medical professional. And what I would say from my perspective before I turn over to the medical professional is that I would offer them as much education as possible. Like, are you willing to investigate these other opportunities, or is this something you're kind of set in with your doctor?
Yeah, so this one can be a tough one. And first, I will always start off with making sure, and I'm sure everyone knows this, to get more than just one opinion, because you might have varying opinions amongst several different doctors. So that might also be kind of a deterrent for someone to get surgery. If one doctor says yes, one doctor says no, then they might be like, okay, well, maybe this isn't the best route to go. Then I always say, let's give it some time. Let's be very consistent with what we're doing to help improve whatever's going on. So consistency for me is probably going to be 8 to 12 weeks working with an individual to see if we can really get relief of symptoms, improve function, whatever those goals might be with an individual, and kind of really address the root cause of why they're feeling the way they are, or whatever injury that they're having going on. And then at that time, they can make a really informative decision if surgery is the right way to go. I know oftentimes it doesn't always work that way. I've had several friends that, choose not to get surgery when they need surgery and opt to get surgery when they don't need it. So it can be really tough.
Yeah. And I think a big thing too is, health insurance plays a big part. When I actually needed surgery, and my neurosurgeon was yelling at the insurance company that this guy needs surgery, they still made me do 6 weeks of physical therapy. Yeah. So oftentimes that's going to be less the case that you're going to go right into surgery, because the insurance companies know that, again, a lot of times these acute injuries heal rather well. And also, if you do some physical therapy, they tend to have a pretty good success rate with mitigating pain, depending upon some of these other factors that we're talking about. If you guys Aaron mentioned before, this will be up on Perform Better, so that'll be a way you can see the slides again. So if you guys want that, Aaron said that will be back up on the app, I believe. Is there any clinic's approach to pursue this? It's not as easy as it sounds, obviously. Well, one, I would say you can take our master class. We're going to delve and spend considerable time in a lot of these different methodologies. But there's other things, like you can look up the pain reprocessing therapy organization. There's books like The Way Out, Unlearn Your Pain. A lot of the top scientists in regards to chronic pain all point to these neurological influencers as being part of the equation with having chronic pain.
Would you be willing? Oh, that one cut off.
So did I see one of the slides that SIPs were good for you? What are your thoughts? I remember Mr. McGill doesn't like SIPs. I'm signing up for your class. Look forward to thank you. In that specific study, it was just a kind of a core stability series. And yes, I think what it points to is that some people can tolerate in pain sit-ups well, and depends on what people's tolerance is. If you took, a lot of times what people don't look at studies too, something that doesn't get really discussed is who they don't put in the study. Yeah. So, when you're talking about people with chronic low back pain, typically they're eliminating people with red flags, people with extensive, pain down their legs, or
it's typically non-specific low back pain. Like, you don't get your radicular patients into those studies a lot. You don't have, like Josh said, like a lot of your red flag patients aren't in these studies. In my opinion, was it the best, well-rounded, comprehensive core stability program? No, but you saw that they got a ton of relief from it. So would I give someone sit-ups that is in, high levels of pain? Probably not, but they did do the curl up in there, and that's one of the McGill big three. But again, that could be aggravating to people too. So if it aggravates someone's symptoms, then I wouldn't do it. It's not, you don't have to do any one exercise. It was just kind of an example that these basic core stability exercises actually do improve one's low back pain.
Yeah. And I think what ends up happening a lot of times is that people don't realize, just like we're talking about in that social media post, I don't know which of those exercises were the most effective.
Right.
Some could slow down the effectiveness too, right? Yeah. So when you have like 6, 7 exercises, it's hard to know which one or which ones were the most effective and which ones possibly were problematic. So it's just to give you a frame of reference when people talk about there's no evidence that core stability helps low back pain. It's quite the contrary. There's a ton of evidence it helps. There's a difference between curing and helping low back pain too, depending upon a lot of situations.
I can tell you, most people, you know, if they're at an 8 out of 10 pain, they would do anything to get to
5 or 6.
5 or 6. So if you're going to be like, I'm not doing core stability because the internet said it's stupid, that's just crazy, because you're just talking about a few exercises that could potentially help someone.
Not sure what that means. You know,
that is formal program that can help clients. I'm not sure what the question is. Sorry.
I have a sense either that this person has childhood trauma, but I don't think I can go there as a trainer. I wouldn't go into their childhood issues. It's awareness to you that because what happens and why the childhood trauma is a thing is because it increases the sensitivity of the nervous system, because it starts to perceive lots of things as dangerous.
Threats.
Yeah. So what you need to do is, this is a person that might benefit more from, the mind body, like the MIM work that we're talking about, maybe the softer, slower movements, more focus on breath work, being educated on how to have boundaries in their life, because they could have, relationships that are very difficult, or, things at work, how do they relate to their work? There are things I would look in their lifestyle, understand that these childhood factors influence the state that their nervous system is now, and teach them strategies that they need to keep their nervous system in more of a safe place, and to deal with things and how they deal with things that are a little bit more difficult. Like the mindfulness, one of the best things about mindfulness, and people don't understand, it's not about calming you down. It's about giving you space to choose to react in a different way. Because a lot of times people are just very reactive to things that happen, especially when they get in a heightened state. So if you can sort of change that relationship, they can keep their nervous system from getting so out of balance where they start to create pain signals far more easier.
So regarding these webinar and the slides, so afterwards, if we receive the recording, I'm happy to email it out to the list of individuals that attended today. So I can follow up. You're not on any specific list. If I follow up with the recording, don't worry. I'll just make sure that you guys get the recording in the webinar, and I can email it out. It would come directly from me.
Is the masterclass free? No, it's not free. We do usually put in about 9 to 10 hours of work into it. It's $99 for the 6 weeks. So that's with the CEUs. Everyone gets the recordings and so forth. We'll also be probably offering some Perform Better discounts on products and tools that we use throughout the program, because we're going to use very diverse tools to do different things.
Pretty interactive over the 6 weeks. Anyone that's attended in the past knows that you can reach out at any time for questions, and it becomes kind of a really intensive 6 weeks.
Yeah, as far as books go, Alan Gordon's book is just really accessible. It's easy. It's something I would give clients if they were open to the information. Another good one is by Dr. Howard Schubner, called Unlearn Your Pain. It goes into a little bit more of the science, the neuroscience, but does do a step-by-step guide upon things that you can do and you can teach people. So even if you don't want to give that to clients, but you want to use it to see strategies you can implement for certain clients, you can do so. And sometimes, again, there are going to be clients that don't want to delve into that. They're coming to you for exercise, and you can start with things like the core stability, the stretching, but you can also help them with their attitudes towards their exercise. If they're feeling they're putting a lot of pressure on themselves, like I gotta make sure I make it, so I get in my workout, so I help my pain, or you help them understand, like, you're being very proactive and you're saying a good environment to help your pain. Don't put so much pressure on yourself. It's about consistency, not how much you do in a short amount of time.
Do ACSM give CEUs for masterclasses? So we haven't had anyone be denied CEUs from other organizations. We just do NASM because it is a low price point 6-week class. So we can provide anyone with course objectives, resumes, anything that you might need to get CEU approval from another organization. I think everyone's gone through several different, I think we've even had PTC use approved, ACE, all these other ones, but we just do NASM just because it's,
there's so many associations out there.
There's so many associations.
Do you consider Pilates, where we focus on specifically what we are doing in the body and progressively see the strength from inside out, a true mind-body workout versus Tai Chi, etc.? A lot of these mind-body practices, yoga, Tai Chi, Pilates, are very different. They're all different from one another. I would say that some of the differences go into the fact that, for example, in Tai Chi, you're in an upright posture, you're accelerating, decelerating in different directions and stances. But there's also, like, in the philosophies of these different practices, like, it's not just doing the exercise, but that's why we created MIM. So a more gym-based, a more fitness-based program where we can introduce this to people that are not coming for these specific practices like yoga or Tai Chi or even Pilates, that are very different. But one of the things that we do is more multi-planar. We teach a lot of the mindfulness and how to interact with the body. There's much more of a stability, mobility component. So they do differ quite a bit depending upon which one you're using.
Does it help post-knee replacement? So all of these strategies help with any type of pain. It doesn't have to be chronic in nature. It can really help you kind of take your focus away from a lot of the pain that you're feeling after a surgery like that. So it does apply to any type of issue that you're having.
The sooner you employ a lot of these methods, and even in acute stages, they can help prevent you from getting into more chronic stages or severity of chronic stages as well. All right. I think that's it, guys.
If anyone has any other questions, let us know. But thank you so much for those questions.
Yeah, if there's more questions, our email's in there as well. So again, feel free to email us. But hopefully we'll see lots of people at the masterclass, and really appreciate this opportunity with Perform Better to share with you guys. And hopefully you get lots of great ideas.
Awesome. Thank you guys so much. And thank you guys for attending. Have a great rest of your week, and we will see you guys soon.
Thanks so much.
Thank you.